Hello, friends, and welcome to the No Bad Shifts podcast, a show for nursing students, new nurses, and all those in healthcare devoted to helping others and making the world for patients a better place. I'm Nurse Studa, your host, here to offer nursing tips, stories, motivation, and conversations with some of my favorite healthcare professionals so we can better learn to collaborate to make the hospital a more positive and supportive environment. Remember, with the right mindset, you really can learn from every day, and there really are no bad shifts. Hello, friends, and welcome back to another episode of No Bad Shifts. I'm Nurse Studa, and today I wanted to give you some simple tips on delegating throughout your day. This is something that I definitely struggled with when I was a newer nurse, and even a year or two in, I still had a really hard time with asking for help, speaking up, and not in situations where a patient was declining and I needed help, but more so just like those everyday regular tasks that I knew I could do by myself and I could get done. I just might be staying a little bit later to finish my charting because I was running around nonstop throughout the whole shift. For whatever reason, I felt this way, and I know a lot of other new nurses will often feel like this. We feel like we have to prove ourselves. And if someone comes up and asks if you need anything, we feel like it's showing a sign of weakness by saying, yes, I would like help, or yes, I would appreciate a hand with something. I don't know, for some reason, I feel like sometimes there's this like imaginary panel of nursing judges that are evaluating my work every day. And I think part of this is just that we want to prove that we can make it, that we are smart enough to be here, that we can hang with the nurses that have been here for a long time. And we want to show them that we deserve it and we can handle the hard days and the tough assignments. We really just want to prove that we belong in the club. And I used to worry that if it looked like I needed help during an assignment, that maybe people would second guess if I was capable enough to do this job, or if I'm a strong enough nurse to be able to handle the floor that I was on. And I think that is all totally normal feelings. And for some of you, it might naturally just go away. But I also think that there are some of us out there that have a hard time accepting help in any parts of our life, or asking for help when it would probably make your life a whole lot easier. Maybe you are also a very high achiever. Maybe you overcommit. Maybe you don't say no. Maybe you just think that if something needs to get done, you would rather just do it yourself than depend on somebody else to show up and do it for you. Maybe you just are naturally that group leader when it comes to doing group projects. Maybe you're the one that stayed up for 20 hours straight doing the voiceover for your whole group's PowerPoint because it felt like nobody else was going to show up, so you just would rather do it by yourself. If any of these things sound like you, these could actually be signs of hyper-independence. I've been known to carry this quality in a few places in my life, and it is something that I'm working on. And I have learned through years of therapy that this hyper-independence is actually a result of trauma. Trauma. I know, such a buzzword. Now, I'm realizing that this doesn't actually have to be a limiting thing if you realize this about yourself. Of course, it's something that we can all work on in so many aspects of our life, but I think being able to recognize this in yourself and actually finding ways to overcome this response, especially in the workplace, is really valuable for you and for everybody around you. Maybe there was moments in your life that you looked to other people to help you or you thought would show up and they didn't. So you have just learned to do things by yourself. Or you did delegate a task and you realize it wasn't done exactly how you would like it done. So again, you just learn, it's fine, I'll just do it by myself. This is how we burn out. When we look at the nurses that are constantly running, constantly saying yes, doing everything that the patients are asking, saying yes to other nurses when they ask for your help, they are the ones who are exhausted at the end of the day and probably go home feeling completely drained with like nothing left in their tank. I mean, I must admit, yes, this is me some days, but I think I've come to a point where I am choosing to do that and I'm not just saying yes or not asking for help as like a reflexive response. I really try to consciously make these choices every day for both me and my patients. Because if I'm the one who's saying yes to everything and I feel like I'm not taking care of myself at all throughout the day and I feel overwhelmed or stressed because of this, that's the chance to miss something or overlook something because we're trying to do too much and rush through things. And it really took me probably until I became a floating nurse that I actually feel way more comfortable with this. So once I joined the float pool, I realized that you cannot possibly know how to do everything. You can't know every situation in nursing, and you definitely can't handle all these days on your own. And I've really learned that speaking up and accepting help has made a major difference in just the flow of my days and that overwhelming feeling that I sometimes would get when I feel like I'm drowning. So obviously in nursing school, we spent so long talking about delegation. We talk about what we can delegate to a UAP, to an LPN, to another nurse, and what are the steps to delegate something, and what's the follow-up, who would be the most appropriate person to delegate something to. Should you miraculously have all these people that are ready to jump in and help you, I bet you pass that section with flying colors because, of course, it all makes sense. It just falls into a category and you know what the aides can and can't do. You know that an LPN is not able to fully assess a patient. So yeah, you know exactly which tasks to pass out to everybody else. The problem though is that in the real world, we don't actually delegate those tasks. So basically, the knowledge is useless unless we put it into practice. And of course, it's a lot easier to delegate tasks to your fake nurse's aide on paper on the test than it is to the aide running around caring for 16 patients on the floor. Even though you have 5 or 6 of your own, but you do not want to be a burden on anybody else or come across as needy or like you're trying to steal your aide's time when you know he or she has 3 other nurses that need them just as much. Or maybe that aide just isn't super warm to you and that quick to want to help you. At least this is my perspective. I worked as a nurse's aide for 3 years before becoming a nurse. So I know what it's like to be running around, answering call bells, getting vitals on all the patients, getting EKGs, taking patients to the bathroom, feeding them, warming up their food, changing them, turning and propping. Like, I get it. And because of that, I am very cognizant about the things that I choose to delegate when I know I am fully capable of getting that routine EKG that the doctor has ordered, and I'm not about to interrupt somebody else and their day to do something that I know I can do. And at the same time, I am also learning how to more confidently delegate these tasks and coming across in a respectful way that is manageable for everybody, because I love my aides. I love the LPNs that I work with, and I am so appreciative of everything that they already do without even being asked. Some of the floors that I go to, the aides always get the vitals and all the blood sugars, and for the most part, I don't even have to check or ask, and I am forever grateful of that because there has been shifts I've worked that I don't have that help. So I know everything is falling on me to get done. So I already always try to keep a very appreciative approach on everything. So yes, while this episode is about delegation, I will first preface it with the idea that we all are working together as a team. We are all here to take care of these patients, no matter what your title is. And at the same time, to be able to recognize when there's moments that your knowledge and your skill is better utilized as a registered nurse and asking for help or accepting help for other tasks that are appropriate for other members of the team to be able to handle. So back when I was working as a regular staff nurse, I had all my nursing big brothers and big sisters, and work moms and dads that I know would look after me. And they were there to help answer any questions I had. And a lot of them really knew me as a nurse and would kind of automatically step in when they could see that I was drowning or I was feeling a little overwhelmed, and would find ways to just help me without me even asking. Now, when I switched to float pool, I did not have that same luxury. So I learned that if I felt like I was getting behind on things, that I was going to need help changing a wound vac or doing 2 discharges at the same time, I found ways to respectfully ask for help without feeling like I am incapable or an annoyance or just whining or complaining, because I never want to come across that way. Because I can't stand when people sit at the nurse's station and complain about all these things they have to do and how busy their day is. We are all busy. We all have so much to do for our patients. And I really don't believe in trying to just pawn that off on somebody else. If I can help a patient shower and I have the time, I would be more than happy to cover up an IV and help them wash up. But now I know that's not the case all the time. So I just wanted to give you some practical tips on either ideas or ways to accept help in your day. Because at the end of the day, it really is about our patients and making sure that they are cared for safely and appropriately. And I believe that you have it within you to do all those things without damaging your pride. So yes, this is a skill like anything else. You have to work on it consistently for it to become easier and more comfortable. And I promise you, once you start delegating simple tasks, you will want to continue to do it. So for me, I have learned that one of the best ways to get a positive response out of delegating tasks is to pick very simple and clear tasks for someone to help you with. I think people do want to help. We are all nurses and in nursing, and I think people generally go into this field because they want to help people. So yes, we shouldn't take it as a surprise when people want to check in with us and actually want to help. And you'll be able to know the difference between someone just saying, "Hey, you okay?" versus someone being like, "Hey, Lindsay, what can I help you with?" And will actually take on that task without holding it over my head or making me feel inferior in any way. And when you have those people, give yourself permission to actually accept that help. So yes, by giving them simple and clear tasks, I think people respond so much better. Of course, if you give someone the task to go do a tap water enema for a patient who's bowel prepping, might not be received so well. Or if you're going through your morning med pass and somebody asks like, "Hey, do you want me to medicate one of your patients?" Don't give them the dementia patient that's been physically and verbally abusive with everybody. Trust me, nobody will ever want to check up on you again. Some very simple things that I have learned throughout the years to delegate that I feel was received very well include things like medicating your easiest patient. Think walkie-talkie, swallows pills whole, short med pass. If I know that I'm going to have a really difficult morning, maybe I have to send somebody to the OR. Maybe I have to crush somebody's pills. Maybe one of my patients takes all their pills one at a time. Maybe somebody has a tube feed and all their pills are going to go through the peg tube. And then I have a walkie-talkie patient. Of course, if it's appropriate and not time sensitive, I will probably say hi to that patient, but I might hold off on medicating them because there are some really wonderful days where our charge nurse does not have an assignment and he or she goes around and helps pass meds on one patient each. And they will ask the nurse, "Hey, who do you want me to give meds on?" And I've just learned that if I can give them someone simple and easy and won't be difficult or rude, I think it's just very well received. And they'll probably likely check on you again. Or if you just have other kind nurses working on your floor and they finish up their med pass early and they say, "Hey, do you want me to medicate somebody for you?" If you can say like, "Oh, hey, I have this really easy patient. They only get a few morning meds. He might want pain medicine. Do you mind doing it?" I bet you they will be happy to do it and also to probably take care of anything else that patient needs in the morning. This has been a really nice baby step for me to practice accepting help, but also not feel burdensome or like I'm inconveniencing the other person. Some other simple tasks that I've found to be easily delegated include doing a routine EKG on somebody. Maybe the doctors just want to monitor the QTC, or the patient is starting a new medication. Again, routine, not somebody with chest pain. If someone has an extra second and is happy to help, great. Getting a daily weight on a patient, taking a patient for a walk, heating up somebody's food, giving someone pain medicine. Maybe you have to start a new IV on a patient that is not time sensitive again, or draw labs on a patient. I always make sure that I have all the supplies in the room. I let the patient know that somebody else will be coming in. And more times than not, people would be happy to pop in and help you find a new IV or to draw a set of labs on somebody. Nurses have been more than happy to help me with wound care. Again, keep it simple. Make sure it's something that you don't personally need to see and assess yourself. And again, if you have all the stuff in the room and the patient's aware, I think that is more than reasonable to offer to somebody if they are willing to help you. Again, making it simple and easy and clear. So sometimes as I'm going through my day, I'm not necessarily counting on somebody checking in with me or necessarily passing any of these tasks or skills off to another nurse, but I almost have a list in my head of things that need to be done. And if somebody would be willing to help me, I could pull from this list and see if they'd be willing to do it for me. Especially if you know that you have a charge nurse that typically will go in and check on you and do one or two simple things in your day that would probably save you, 20 minutes for you to actually go pee or go get a snack or just take some time to step away from the floor quick. Hey, just very graciously accept the help. I think when we practice this and actually believe that we are deserving of help, I really do think it can make your days so much smoother as a nurse and so much more enjoyable. And you might find that you have less resentment towards other people or other nurses. I know personally as a nurse, I will get frustrated if I feel like I have a really busy assignment and I am still running around medicating people or trying to get discharges in order and I'm getting hit with an admission. And I see nurses at the nurses station just gossiping or talking about their weekend. And that can be a really frustrating thing. And I've learned that if I am bothered by that, I can either ask them for help, or if I'm not willing to ask them for help, then I really shouldn't be complaining about it or be bothered by it. Now, if I ask for help and they say no, that's a little bit different story. But again, I think more times than not, sometimes people just aren't thinking about everybody else and they have their work caught up and it's probably nothing towards you, but they're just kind of in their own world. And there's nothing wrong with that. But at the same time, if you see nurses sitting around and you literally haven't stopped for the past 4 hours, I think it is totally reasonable to say, hey, any chance you could hang an antibiotic? I'm stuck in this admission and he's a little complicated. Or, hey, I'm trying to do discharge instructions for this patient going home with a Foley. Any chance you could check my guy's sugar and just give him his insulin before he eats lunch? My patient's really trying to get out of here and I feel bad holding him up. I think sometimes if we also explain our reasoning and not that we just are trying to push our work off and onto other people, I think people are so much more receptive to that and will probably be more than happy to help you and might actually check up on you again and say, hey, how are you doing? Is there anything I can do for you? And then at the same time, if people do offer to help you and you say, no, it's okay, I'm fine, I got it, or no, it's okay, I'm okay, there really isn't much room for us to feel resentful or angry towards other people when they're sitting around and all caught up when we didn't accept the help. So I totally invite you to find your own voice and your own way of saying yes to help and speaking up and politely asking for help in your own kind version. Part of my work for me, just as a person in general, has been to find ways to communicate in a way that feels good to me. I'm just not going to be someone that comes to the nurse's station and yells about all the things I have to do today. And I've learned that because of that, people might not know that I need help. So I am learning how to use my words and use my voice and ask for help help in the times that I know I really need it, because I do think there is some component of the nurse who cries wolf. I think if I try to do as much as I can on my own, and I have a day where I really am drowning and I do speak up and ask another nurse or ask an aide for some help, my hope is that they might understand me, that I'm not usually someone who tries to push things off onto other people, and that they'll be more willing to help me when I feel like I really need it. Because if I do have the time to be able to help feed a patient while I'm also giving them their lunchtime meds, I'd be more than happy to do it. Or if a patient asks to get washed up, I have no problem grabbing them all the supplies and getting them set up. But on days that I know that I can barely get my nursing tasks done, I might ask if one of the aides has time to be able to help a patient in the shower. But that's another thing. I really always try to ask if they have the time to do something, because of course we are all busy in our days, and I have no idea what else was asked of that aide or LPN. And I don't want to just assume that they're going to put my task at the top of the list when other nurses might have already asked them to do something else. Because if a patient is having chest pain and you need an EKG, if you ask your aide to just go grab an EKG, that task might not get done until that aide has time to do it. And now that is your nursing responsibility to make the call and the judgment of what needs to be done right now. So yes, aides can grab EKGs, but right now your patient needs you to go grab that machine and get those stickers on them and get the EKG and send it to the doctor. So always just be mindful of the things that you are delegating. If it's time sensitive, either do that task yourself or just make sure that it is very clearly communicated. But take notice in your day, things that you feel like you could delegate. So as these opportunities come up for you to speak up and to accept the help, it will feel easier to say yes. And at the same time, take notice of things that other nurses delegate to other people, or what other nurses ask you to help them with. I've had plenty of nurses ask me to put IVs in, or to go hang an IV med, or just to go help settle their new admission and just make sure they are safe in their bed, or just hang a new bag of fluids. People love doing other nursey tasks. They don't always necessarily love helping to clean up your patient, but just start to take notice and see how you can use that information to incorporate into your days to make your life as a nurse more manageable and more enjoyable. And then on the total flip side of this, see if there are moments in your day that you are actually in a really good place and caught up and can look around and see maybe where you can be of service to somebody else. I totally believe in karma. And when I get time in my day to be able to help another nurse, to just do something simple for them, I hope that then when my day comes and I'm drowning, someone just shows up and is happy to lend a hand for me. But see if there's a nurse that you notice hasn't sat down since he or she got report in the morning. Or maybe somebody has a really acute patient that is eating up a lot of their time. Or maybe somebody is in a rapid response and you aren't able to actually help in that situation, but maybe you can take a look at that nurse's other patients and see what you can do to ease the burden when they do come out of that rapid and they feel like they're super far behind. I remember one time I had a rapid response at like 8:30 in the morning, and it ended up taking almost my whole morning from me. And finally, when I got out of the room, I was like, oh my God, I still have to medicate the other 5 patients. And I come out and there was a nurse that happened to be there as helping hands. And she told me, Lindsay, I medicate the rest of your patients. This person, we're just waiting on a med from pharmacy, but they're all settled. And I was like, oh my gosh, thank you so much. I couldn't even say thank you enough times. But I think if we can all just be on the lookout for each other and also just be supportive in lending a hand and accepting the help and genuinely wanting to be there to help other people, I think this will help boost the whole morale on the unit. And the more we do these things for each other, I think the more supportive environment we are going to foster. And I really think these simple and kind acts in our day can really change the energy of a unit. So let's try to fight that inner voice of feeling the need to be hyper independent and do everything by yourself and handle everything on your own. And remember that you are deserving of help and that it is okay to experiment with finding ways of delegating or asking for help in a manner that feels safe and right to you. So let's promote teamwork and just that kind culture that wants everybody to have a better shift. Thank you so much for taking the time to listen. You can find me at Nurse Duda on Instagram, and feel free to subscribe and rate and review. And as always, I hope you have an amazing day and may you find light in every shift. Until next time.